many health agencies, including Health Canada, FDA, they're very well aware that this SV40 is in the shot vials. They are completely undermining the potential danger associated with this. There are a lot of people who think this is all intentional and that they're trying to kill us. Even if you don't believe that, you have to admit that this is the greatest buggery of this scale of human beings ever. This was not about a virus, guys. This was about a system of control being imposed. When you don't tell the truth and when you're not transparent with data, you're pushing products to get them on the childhood schedule because you're free from liability and you make $1 billion off that. Are you really concerned about my health? They were going to go full on digital ID, 15-minute city type thing, like you can't leave your area. Trump made the comment about Operation Warp Speed and he was demanding data from Pfizer. This is huge. I anticipated that we were going to start seeing enormous numbers of people reporting adverse events. The total number in the past 30 years of data collection in VAERS for all vaccines combined has been about 39,000 on average. And in 2021 alone, there were over 1 million reports. There was a big death signal in January at the end. In the past, historically, would have prompted the immediate withdrawal of the product from the market. I'm an academic. Peer review has been my thing. Now I know it's all a big joke.
Yeah, you don't have to worry about the name of the spelling. We take it off in post, so it's just our pictures, and people will know. We're sitting down with Jessica Rose. You can't see her name on the video right now if you're watching on YouTube or somewhere else. But I'm sitting down with Jessica Rose, who I was introduced to by our good friend who's been on the show a couple times now at this point, Kevin McClernand. We've talked about the DNA contamination of the COVID vaccines, and after last time we spoke, he was adamant that I have to reach out with you and get you on the show. A bit of a delay. He introduced us in March. We're sitting here in the beginning of September, but I think it was a happy accident because there's a lot to talk about with everything going on. And so
yeah, it's a good delay. There's nothing wrong with it.
And that's why I reached out to you, because I remember Kevin introduced me to Jessica to talk about this stuff. And we have a lot going on Capitol Hill. It seems like RFK Jr. is actually getting his way. We have a lot of people leaving the CDC. We're finding out about the individuals who are at the CDC pushing the vaccine mandates during COVID. And I just wanted to get you on to get your perspective on what do you think's happening at that level right now? Do you think we're on the path toward some sort of unearthing of what actually happened and getting the real data out to the people?
I do. It's been wild to watch. I mean, I don't know how long you've been watching all this stuff unfold, but I mean, I've been digging into the data, the adverse event data for 5 years now. So I mean, it's been a horror show since January 2021, and I'll elaborate on that in a second. But it's amazing that the feeling in the community of people I'm in, and it's a very broad international community of people, from lawyers to doctors to teachers to vets, and podcasters, everyone in between. There's a real feeling of, wow, as in more than hope, it's actual surprise, because and it's not that I think people are surprised that we're starting to see actual movement on the subject matter of vaccine safety. It's that it's almost hard to believe, if you know what I mean, because I don't even think we, as a community of people who are digging into this all the time and who dedicate our lives to the science, know how bad it is, know how shielded the data is, know how many studies have actually been conducted by pharma companies themselves that reveal catastrophic adverse events that we don't have access to, we don't know about. This hearing that Robert F. Kennedy Jr., as we all know, is the new Secretary of HHS, recently, I would say, was subjected to, was just, beyond revealing. The people, the small clips that I've seen of the of the entire session, which I haven't watched in full, were so astounding. I mean, there were so many ad hominem attacks. There were so many juvenile lash outs. It's just not something I would expect to see from a room full of heavy hitting professionals, senators and doctors. And you know what I mean? It's like, I would expect it to be more civilized. So it's not that I think it's a bad thing that it happened, that it's being revealed this way. I think it's actually very, very telling as to like why are people getting so defensive on the subject matter? Because Robert hasn't changed his position. All he's trying to do is get science-backed data to actually have the outcome of safe products on the market. That's all he's looking for. There's nothing to defend right there. He's looking out for kids. He's looking out for parents. He's looking out for American people in general. It's like, what is there to defend? So the reactions I saw from people just at this hearing were stunning. I mean, are they worried they're going to lose their handouts? Are they worried that some weird personal truth is going to come out about them, about what they've been defending and why? I mean, it's bizarro world. But again, I'll go back to what I started with. It's beyond hopeful. It's actual movement forward, I think. And just one more thing about that. When Trump, you saw the post on X where Trump made the comment about Operation Warp Speed, and he was demanding data from Pfizer. This is huge. If he stands by that, and if he actually follows through with demanding this data, me and Kevin and David Speaker up in Canada are probably going to have a paper published today or maybe tomorrow that's been, in the peer review process for years, literally years now, that reveals so many things about the modified mRNA products pertaining to DNA. I'll just call them contaminants. Trump needs to know this stuff. And I know that he's not a scientist, but he'll understand, the word contaminant, and he'll understand that, from another point of view, these things are gene-based therapies that didn't go through, the proper channels to get approved, for example. So I think there's a real reason to be optimistic after all of this time. That's what I would say.
Yeah, it's incredibly encouraging to hear, because that is one of my biggest worries. And it was funny. I sent a tweet out earlier this week. I forget exactly what I said or what I was quote tweeting, but it pertained to the COVID vaccines and the potential to actually find out what's happening and let the American people get access to the data and do their own research. And somebody responded like, "Why are you still on this?
Yeah.
Give it up. COVID was years ago." It's like, no, we cannot.
No.
You cannot just let this fall to the wayside. There has to be some accountability, which is desperately needed, because I said it before we hit record, but I'm a strong believer that what happened between late 2020 and up until today, to some point, with mandates are still being issued to people in certain positions or schools, is a crime against humanity.
Yeah, and it's not only America. I mean, Europe's still pushing the COVID stuff. There are countries all over the world who are still very much fully caught up in all of this. And, everybody's seen it on the news. There's this kind of resurgence of fear factoring going on with, there's a new SARS strain and people are getting COVID again. No. The one thing that is true from what people are saying, that COVID is over, is that it is. And it was a long time ago from an immunological point of view. So it's wild to me that there's this dichotomy between the hundreds of millions of people who've suffered adverse events directly as a cause of these modified nucleoside modified mRNA injections, And the people who still have no awareness that there's a problem at all, it's really, it's wild because these two groups are real. The latter group are actually, like, I think slowly, there are people coming out of that group and starting to open their eyes as more of this becomes so-called mainstream, which is thanks to the new administration. Whether you like the people involved or not, it doesn't matter, man. They're moving the target, so you got to appreciate that. After stagnancy for so long, decades, when you're talking about vaccine safety. So just to, if people don't know what I was doing with the vaccine adverse event reporting system data set in the US, I started digging into this the day that the shots went out on December 17th, 2020, because I anticipated, because of what I was seeing, the one-shot solution, the novel technologies involved, I anticipated that we were going to start seeing like enormous numbers of people reporting adverse events, and serious ones too, because for people who don't know, there are two brand new technologies involved here. These lipid nanoparticles, which are not safe. They use these things called cationic lipids as one of four, which are highly positively charged, which are murder to cells, and nucleotides, which are embedded therein. And it's supposed to be only this nucleoside modified RNA. But as I'll talk about later, I hope, according to our new publication and other peer-reviewed publications, there's way too much DNA in there as well. It's not supposed to be there. And that comes with a boatload of problems that absolutely would be associated with disease and pathologies like cancer. So in January 2021, at the end of January 30th, there was a very large death signal in VAERS. And this is a passive reporting system. So underreporting is actually the biggest problem with VAERS. A lot of people call it like a dumpster, which I find very offensive, because every single one of these reports is a person who was injured because they took a vaccine, and they matter. Every single person matters. And if you actually succeed at filing a VAERS report, which is not an easy task, it's an online system with multiple e-pages that if you don't complete in time, they kick you off and you have to start again. And then it has to get vetted after being given a temporary ID. And if that's successful, with the limited number of people who are doing the vetting, you might get a permanent VAERS ID, and your data point might be uploaded to the front-end system. But that's not the end of it. It might also be removed, as I've also written a paper about, with no explanation. So there was a big death signal in January at the end, which under normal circumstances and in the past, historically, would have prompted the immediate withdrawal of the product from the market, these modified mRNA products from the market. It was like 500 and something reports of death within 30 days, which is that's a lot of people to die at the hands or in the context of a product that's supposed to be, helping people. And that's just one. The number of adverse events, I'll give you some context here, that are typically reported in the context of the flu vaccines, for example, like the number of types of adverse events of the 25,000 potential MEDRA-coded adverse events that you can use is about 5,000 something in total for, say, like a season, a flu season. And the number of types of adverse events that have been reported in the context of just the modified mRNA shots is over 14,000. So there's not just hundreds of thousands more adverse events, millions, in fact, being reported when you compare, like in the context of the COVID shots versus the flu shots. There's so many more different types, which matches perfectly with what we're seeing in a clinical setting pertaining to the comprehensive nature of the damage. You've heard it all, right? Like there's neurological damage, there's immunological damage, heart damage, lymphatic or the endocrine system being ruined, birth defects, fertility problems, cancer. I mean, you just name it, and it's there, and it's been there from the very beginning. So you can, I have written papers about this and published them. You can find that on my Substack if you're interested. But the point in all of what I'm saying is that this data, the VAERS data, is accessible to the public, which is why I chose it. And it's been showing signals for a very, very, very long time. And now we're up to about, last time I checked, it was like 1.6 something million reports in the context of these shots to date. And again, just for context, the total number of adverse events reported in the past 30 years of data collection in VAERS for all vaccines combined has been about 39,000 on average. And in 2021 alone, just 1 year, there were over 1 million reports in the COVID shot context. So there's just like, there's no looking away from this. So I'm really glad, going back to the first question about like what's going on with CDC and even hopefully FDA and HHS, is that those guys are the owners of this data set. And it's their job. They're tasked with the job of looking at this data, analyzing it, doing further follow-up causality assessments. And the CDC director at the time, Rochelle Walensky, is on record having said that there's no signal. There are a number of documented reports from the employees of these organizations making like assured statements that there's no safety signals that we should be concerned about in VAERS, and it's absolute rubbish. And it's, by the way, everyone's heard about myocarditis now, but it's that is just the tip of the iceberg. I'm glad that it's gotten a lot of attention, but on the other hand, it doesn't address all the neurological problems that people are seeing, which, depending on who you are, you might actually consider brain damage a little bit more, hard to deal with than heart damage. So,
yeah, I mean, I haven't been able to validate whether this is true, but I've seen people in recent months tweeting that the amount of gray matter appearing in brain scans is increasing.
Wow.
And again, I haven't validated. I've just seen it. Could be fake news, but like what is equivalent to like a lobotomy has been found in some people.
Wow. I'll have to look into that. Sorry, go ahead.
No, it's just astonishing to me that, I mean, the numbers that you described for the COVID vaccine in the VAERS database is astounding. That's 1.4 million that were actually made it through the process and are on the front end. And so that's underreported. Bingo.
And that's just VAERS. And another, I'm trying to remember everything, the most important points. There are pharmacovigilance databases used all over the world. Like Australia has one called the DANE. There's the UDRA system in Europe. There's the Yellow Card system in the UK. There's VAERS in the US. There's CAFIS in Canada. There's, and the thing about it is you have to comb really hard through the other data sets, which really aren't user-friendly. But when you do, the signals are exactly the same. And I don't mean similar. I mean, they're exactly the same, numbers-wise and also systemic nature-wise of reports and age group-wise. Nobody's immune. Like, whoever got the shots, for example, if you have a pre-existing condition, or if you have a lurking condition, or if you have a latent viral, a latent virus, like all the herpes viruses, you get reactivation. It's like something in these shots causes some horrid level of immune dysfunction, which just wreaks havoc on anything lurking, if you're catching my drift. If you have an autoimmune condition that was that was stable, how many people do I know? How many people have I heard reported have that condition reemerge? Everything you can name. Autoimmunity is a whole other subject matter, which we should talk about. But yeah, VAERS is just one data set, and it's just it's wild how again, just by looking at that alone, I'm not saying like you can definitively say this or this. What I'm saying is the owners of the data cannot deny that there are massive safety signals in that data set, and they have to explain why. They have to. This is people's lives on the line, and people were mandated to get these shots. So it's like, it is criminal,
Sup, freaks? This rip of TFTC was brought to you by our good friends at BitKey. BitKey makes Bitcoin easy to use and hard to lose. It is a hardware wallet that natively embeds into a 2 or 3 multi-sig. You have one key on the hardware wallet, one key on your mobile device, and Block stores a key in the cloud for you. This is an incredible hardware device for your friends and family, or maybe yourself, who have Bitcoin on exchanges and have for a long time, but haven't taken the step to self-custody because they're worried about the complications of setting up a private public key pair, securing that seed phrase, setting up a PIN, setting up a passphrase. Again, BitKey makes it easy to use, hard to lose. It's the easiest 0 to 1 step, your first step to self-custody. If you have friends and family on the exchanges who haven't moved it off, tell them to pick up a BitKey. Go to bitkey.world, use the key TFTC20 at checkout for 20% off your order. That's bitkey.world, code TFTC20.
Over 10,000 investors downloaded the original How to Position for the Bitcoin Boom when Bitcoin was just 27K, and it called for 120K plus. That target's now hit. So what's next? Tour de Meester is back with the 2025 edition, refreshed for the mid-cycle moment, packed with new data, new insights, and Tour's latest price outlook. Plus, you'll get exclusive access to Charting Our Way Through Chaos, Tour's new 30-minute Q3 2025 presentation explaining why this bull run might be only just beginning and what forces could push it to the next level. Read the first ever mid-cycle report from Adamant Research at unchained.com/TFTC. That's unchained.com/TFTC. And also, if you're using Unchained, you can use the code TFTC for $50 off any of their services. Go check it out. And the lack of accountability, the inability to recognize that there are these glaring sort of alarm bells going off in the data sets. I mean, it doesn't do them any favors that they don't address it, because it leads one to go down the path of sort of the being very pessimistic about the intentions of it all. Like, it almost seems intentional. It's like, why are you trying to hide this? Because I remember when the VAERS conversation started popping up in mid 21 and persisted for the better part of a year and a half after that. Like, people were just flippantly disregarding VAERS. So like, oh, it's not a reliable database. There could be a lot of bunk data in there. But up until that point, it was sort of used as a reliable database. But all of a sudden, because there was bad information about this particular vaccine, it suddenly became unreliable and something to not look at.
Yeah, that's right. And then we get blamed for vaccine hesitancy when they completely, evade their own jobs. Yeah, it's crazy. The thing about it is, like, it's just what you said. They just had to do, and what I just said, they just had to do their jobs. They just had to be a little bit transparent and honest. It just ain't about public health. There's no public or health with regard to anything that's happened in the last 5 years, and probably way longer before. And very importantly, for anyone who's trashing VAERS, go ahead, do what you want. But remember that this is a government database. It's a pharmacovigilance database, and it's designed as part of kind of the post-clinical trial phases. So you have animal trials, which we didn't have, and then you have phase 1, 2, 3. Each phase increases in number and strength and power. They have to be sequential. They cannot be overlapped. All of these rules, by the way, were broken. And this process, this animal trial to phase 1 through 3 process for a conventional vaccine takes about 10 years. This is standard. So this was all squished into about 6 months. Many problems therein. And the phase 4, which is what I like to think of it as, is the pharmacovigilance. You put the product, whatever it is you were trialing in the clinical trials, into a very large number of people. In this case, it was like billions of people. And you have to monitor what's going on, because the demographic is going to be much, much, much broader. You're going to have more ages. You're going to have more people with conditions that were excluded as part of these exclusion criteria in the trials. For example, people who smoke, people who are pregnant, people who have autoimmune conditions. It's the job of pharmacovigilance data collection to detect these signals. That's what VAERS is. It's actually really valuable. And I'm saying that from a person who's been looking at it for years. The data therein is so plentiful. It's annoying that it takes so long to file a VAERS report, but the good part about it is that you can enter so much data. You can enter free text, which is basically just the doctor's notes. If it's you, or if it's your GP, or if it's a nurse practitioner or a parent or whatever, whoever is filing the report, you can write as much as you want about the real story of what happened. You can put your opinion in there. You can put your vaccine history. You can put everything. And if you're willing, like I am, to read through the free text, in addition to looking at the age data, in addition to looking at the state, in addition to looking at the dose, blah, 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 you will learn so much about what's going on. It's like reading between the lines. So I would argue with anybody who wants to say that VAERS isn't an invaluable data set. It really is.
And was it the COVID vaccine particularly that drove you to make sure that you were paying attention to VAERS, or was this?
100%. I didn't know about VAERS before any of this. Okay. The only reason I got into this actually was because I had just finished my second postdoc, and enough was enough. I was ready to just surf for a long time. I'm a surfer, by the way. And I planned this big trip to Noosa. I was going to showcase my talent for the WSL. I had a spot in the Noosa Surf Festival. Everything was paid for, bought, but it was happening at the end of February, early March 2020. So you know what happened then. So I had to cancel my trip, and being the proactive person that I am, I decided that I would start paying attention to what was going on. Because, I mean, when I hear the word zoonotic pathogen, my ears perk up, because that's what I study. I mean, that's what I do. I'm not a data analyst by training. It's just a part of all the degrees that I've done. I'm actually like an immunologist who studies viruses. So yeah, I just, like I said, I started looking around. I was watching the Johns Hopkins death board every morning with my coffee, like, oh my God. And then about like 7 or 8 days later, I'm like, oh Jesus, this is a joke. This isn't what people are thinking it is. And it was just by listening to the language that was being used. For example, the new technology, the one-shot deal, injecting everyone during the pandemic all at once, regardless of immunity, natural immunity. Yeah, then the police forces, like, forcing you not to go outside and walk around. It was like, there's something else going on here. So, yeah, I decided to teach myself how to use R, and I dove into VAERS, like I said, because it was freely accessible and easy to access. So yeah, I was, people probably think I'm an anti-vaxxer, but I'm vaccinated out the yin yang. I mean, before all this started, I was like, if I traveled like to a place where there were endemic viruses, I was going to the doctor and saying, what do I need to get injected with to be safe? I was that person. I remember getting pretty sick once from doing that. But not anymore, man. Bueno shifto 180. I'm never getting injected with anything again for as long as I live. It's their fault. I'm sorry. It's like when you don't tell the truth, and when you're not transparent with data, and when you're pushing products to get them on the childhood schedule because you're free from liability and you make $1 billion off that, you kind of gotta side eye people and think, all right, are you really concerned about my health, or are you really concerned about your pocketbook? And so, yeah, it's like, I'm not sure that we're ever going to get to the point where we have a wonderful vaccine schedule that's actually ensuring the safety of the masses. I'm not sure we're going to get there, but what I would hope is that all these, can I swear?
Yes, you can swear.
Okay, all these bullshit vaccines that they're trying to inject newborns with, like Hep B, I hope that all that stuff is just completely eliminated, because they're just money-making schemes. There's absolutely no medical or immunological reason to be doing that. And when you combine the fact that there are so many adjuvants like aluminum, there's so many byproducts, DNA contamination, there's so many things you have to factor in, and also pre-existing conditions, you have to consider that there are risks as well as potential benefits when you vaccinate with anything. So it's like, I really hope that we just get some balance back, which is what I genuinely believe Robert is fighting for. Yeah, he's worked all his life for this, and he's poised, man. He just needs to keep going.
He really does. And it was encouraging to see the move that Florida made earlier this week, taking away mandates, giving people their bodily autonomy. I mean, as a parent, like I said, we had our first child last week, and we had to deal with this in the hospital.
What did they try?
They tried. They did. Hep B was right there, and we were like, no, thank you. And
vitamin K, right?
Vitamin K, and they give like an eye antibiotic in case the mother has gonorrhea too. So we were very adamant, like, okay, my wife tested negative for Hep B and doesn't have gonorrhea, so we're thank you. But they're skeptical, and then it leads you to question the motives and intentions. And as it pertains to the COVID vaccine specifically, that's, I think, the thing that I'm most interested in getting to the bottom of is, was this just a money grab by big pharma, and they were able to influence the politicians because of their lobbying efforts to really brute force this on the market? And then again, because there hasn't been any accountability, and they refuse to acknowledge data and confront the glaring problem in front of everybody, you have people who are more conspiratorial, saying we're looking at a massive debt problem here in the United States, looking at the Social Security liabilities, and maybe there was a intentional culling of the population to bring down those expenses. And I'm not saying that is the case, but because there's no accountability and no sort of retrospective on what happened, and people are not forced, but they're naturally going to explore those potential intentions.
Yeah, and it's responsible to, because where there aren't answers, we need to seek them, especially since there's so many bloody questions. I mean, God, I think that's all going to come. Like, I know a lot of people who've been doing some excellent work using various databases, who is pretty irrefutable. I mean, what we need to do now is bring these people and their data and their analyses to the right eyes. And that's what we're ripe for right now. So that's why I'm really optimistic. That's one of the things that I try to do, because for some reason I know a lot of people, and someone will say, hey, do you know this person? And I'm like, yeah. Can you get this? I'm like, yeah. And, it's just, okay, now that person has their eyes on this, and they can see for themselves. They can criticize it for themselves. Like, what the data is like, how authentic it is, what the analysis is, da, 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 da. So the amazing thing about that is that there are so many people who are really, really serious, scientists, medical doctors, even lawyers, like, who are teaming up to just really irrefutably present data. The problem has always been, well, not always, but always. For a long time now, especially in the last 5 years, is the, the, what would you call it? Censorship. That's a good word. Of work and data, so that it doesn't make it to the right eyes. I have this kind of infamous paper about myocarditis that I penned with Peter McCullough right at the beginning that got withdrawn or retracted, whatever you want to call it, without explanation. There was nothing written pertaining to plagiarism, bad data. There was nothing wrong with the paper. They just said it was their prerogative not to publish it at the last minute. So it went dark for 2 years. And this paper, which has since been published and updated, back in 2021, October, was when it was originally published, clearly demonstrated what we all kind of know right now, which is that there's a huge myocarditis signal in the context of the nucleoside modified products in kids, specifically like 12 to 15-year-olds. So the thing that really bothers me about that whole censorship deal are the number of kids that subsequently got injected by unknowing parents because this information wasn't readily available. So this is criminal. People have been robbed of the of choice. Even if we are living in a world, illusion of choices, whatever, it's better to have some kind of choice. Like, give me the information. I can decide if you're crazy or not, or if the information is good or bad, and if I want to inject my kid with whatever or myself. That was taken from us. So, yes, it's all shall be revealed.
So, freaks, this rip was brought to you by our good friends at Obscura. Obscura is the first VPN that can't log your activity by design. Instead of empty promises, Obscura fully embraces the Bitcoiner don't trust, verify mantra. They can't log your traffic, even if they tried. Obscura believes that user data is toxic waste. In addition to private payments via Lightning, you can sign up with an account without having to give any personal identifying information. It's a beautiful thing. It's the VPN I use every day. It's incredibly fast. You can go on streaming sites with it. They don't say, hey, you've got a VPN. It just works. So go to obscura.net. Use the code TFTC25 for 25% off an annual subscription. Obscura.net. Use the code TFTC25 for 25% off an annual subscription.
What's up, freaks? Your hardware wallet holds more than just Bitcoin. It holds freedom, independence, your future. But freedom is fragile. Even offline devices can be exposed. Signals leak, data can be scanned, and bad actors don't need your keys in hand to target what's inside. That's why I secure mine in a silent Faraday bag. Their Faraday protection eliminates every signal, cellular, Wi-Fi, Bluetooth, GPS. When your wallet goes inside, it goes dark, completely off-grid. This is the same tech trusted by special operations. It exceeds military standards, built to secure what matters most. Your Bitcoin deserves that level of protection. Keep your wallet safe, keep your freedom safe. Visit slnt.com/TFTC to save 15% and get free shipping on qualifying orders. That's slnt.com/TFTC. Protect your future, secure your data, and stay one step ahead. I've got this sleeve bag. I keep my Q in it. And I've also got this wallet. I was using Bridge Wallet for a while because of the RFID protection that it provided. This is way thinner, fits just as many cards, and has a better design. No more clunky wallet in my pocket. The silent card holder is what they call it. I'm loving this. So far, I've been using it for about a week. Very sleek. You can see here, I've got my tap signer. I can tap my phone on it. It's not picking up the NFC. It works. It works. Go to slnt.com/TFTC.
Yeah, I'm getting infuriated again. Like this channel, we got put in YouTube timeout 2 or 3 times, and I won't even say we and at that time, like we know, like a few months into the pandemic, like, okay, particularly on YouTube, and at the time, X, you had to be very particular with how you worded things. So we were careful, but I had 2 doctors come on. We weren't even talking about the vaccines. Vaccines hadn't even been released yet. This was like mid 2020. We were talking about ivermectin, hydroxychloroquine, and sort of preventative or using those as ways to treat COVID early in the process. And these are Dr. Woods from Wyoming. He was 72, a nice, humble, gentle man, just really describing what he was seeing on the ground in Wyoming and how he was treating his patients and how it was successful. And they ripped it off YouTube and told us to shut up and not talk about that.
That's unbelievable. Like, that's just a quintessential example. Like, normal, good doctors just doctoring, like it's never not been the case. No matter what the CDC says, they just have like recommendations that they can give. It's never not been the case that the call, when it comes to illness, disease, whatever, is made between the doctor and the patient. That's another thing that was taken from us. It's like all of a sudden it became the norm that doctors have to take diktats from agents, 3-letter agencies with revolving door antics with big pharma, who are just simply recommending things. Like it's crazy. It's crazy. Like it's
and then you come out and then you come to find that some of them are literal Satanists.
Yeah, right. Oh my God. Like I was at dinner with with the Brownstone crew the other night, and Jeffrey was saying, like, we used to joke, back in the day that what if the CDC is run by a bunch of Satanists, and now it's not a joke. The CDC is run by a bunch of. It's just crazy. Like what what should be a joke is real, and it's like, for me, these are also good. They're good flip points for I'll call them naysayers or non-believers in the truth, because it's like, listen, this isn't us. That's them. Like, they took that picture. These are their weird personal beliefs, which they're allowed to have, whatever. But it's my opinion that if you hold a certain position, you have to maintain a certain modicum of professionalism at all times, really, because you hold this position, and you can never let your personal beliefs bleed into your job role or policy decisions, or it's like that's what's happening. It's like everything has become a weird, like, I personally believe this, so I'm going to impose that on everybody in America. It's like, what? That's not how it works, and nobody likes that.
No, and
yeah.
it's been incredibly detrimental to the nation on many levels, from a health perspective, from a trust perspective, and I think the corruption of the system and how deep it goes is completely maddening. Going back to your point about the sort of questioning that RFK had in front of congressmen on the Hill, I mean, it's crazy how transparently corrupt it is, because I'm sure you saw, but there was like a leaked memo from big pharma lobbyists that hit the tape last week to basically laid out the playbook for how they're going to combat RFK Jr.'s policies and try to drive a wedge between Maha. And they literally had a multi-million-dollar campaign, and they wanted to enact it on August 30th. And this is the same day that you have Bernie Sanders, Chuck Schumer, many other politicians coming out with the same rote script via Twitter. And it's just very obvious that, you guys they're coordinating an attack to prevent this information from getting to the public. And that leads to the question, like, what are you afraid of? Like, what do you think will happen to 3-letter agencies, big pharma, if we do get our hands on this information and successfully disseminate it to the public?
Yeah, they're all going to be ruined. I mean, if it authentically comes out, which I think it will. I mean, whether or not people are going to believe it is another question. And it's a good question, because it's, it's so unbelievable, a lot of this stuff. Like, just from the amount of money that a lot of these people are pocketing, it's crazy. Like the it must not be easy to be in the position they're in. And I'm a very empathetic person. And it's not that I feel compassionate toward these people, but I almost feel sad for them because like their entire playbook, like some people actually believe that some of the senators who are wailing on RFK believe what they're saying. And maybe they're right. But maybe they've been caught up so long in the machine that they're locked into, which is designed to protect, the agencies and the companies that they're working for and with, like by contract. Like my take is they probably know how bad what they're doing is, and they're just contractually obligated to protect, the assets, I'll call them, the things that they're involved in maintaining, like the big pharma schedule, the vaccine schedule, maintaining new products, getting on the childhood vaccination schedule so that another company makes another billion per year, with liability free. It's like, I love trying to get into the head because, it's important to do this, to not only empathize, but to try and get into the head of the people that you're trying to understand and also communicate with. Because, sometimes you can actually break through to someone who's really not been doing the right thing. And they're going to become the most powerful ally of all, right? But I found that I have an inability to really empathize with any of these people because they're strange to me. They're so chaotic and they're so emotional. And every time you have an emotionally based response to something that's really not, it shouldn't be. Like if you actually believe that the data provided by the pharmaceutical companies is good and that the product is safe and effective, you don't need to get emotional. You don't need to be like, almost in tears defending a corporation. You don't need to do that. I can understand if you're defending children and you see that they're dying at the hands of a product, but it's weird to me. It's like that's what I started with. I found the number of outbursts was way too high. It was very. It's like you're watching them flail at the last moment, when they know that they might have a chance to keep the machine running. I don't think they will, though. I think I saw a statistic today, I don't know if it's right, that said that about 70% of the American people are backing RFK, regardless of what we saw in that room, So, and I think that's probably correct. Because he's not looking to, tell people what vaccines to take or to, harm the American people. He's really just looking for to do things bloody well right, like probably for the first time since this whole vaccine machine came upon us. And it's all their fault that there's vaccine hesitancy and that everyone's starting to question the entire industry now, not just the COVID shots. It's their fault.
Yeah.
Sup, freaks? Guess what? We launched a browser extension. It's called Opportunity Cost, and it helps you see the true cost of everything in Bitcoin, convert prices to Bitcoin as you browse the web. Opportunity Cost automatically displays fiat prices in Bitcoin or sats, helping you think in a Bitcoin standard. It works on Amazon, Zillow, X, your bank account, QuickBooks. You can convert everything to Bitcoin. It's really cool. It's also 100% open source, MIT license. We don't collect any data. All of the conversions happen in your browser on your local device. It's a great way to recalibrate your life and begin thinking in sats. Go check it out at opportunitycost.app. That's opportunitycost.app.
And the other thing is none of it is seeped in logic. Like to your point of, I don't understand why these people are vehemently defending the big pharma industry and lashing out against others who maybe vaccine hesitant, where it's like, okay, if these things are effective and they work and you're vaccinated, you shouldn't have to worry about people who aren't. It's number one. And then number two, which is truly disgusting and literally leads me to believe that there is some demonic evil forces behind it, is like the fact that if you get one of these things on the childhood schedule, you are free of liability. It's literally hiding behind children and putting them at risk to skirt liability, which is absolutely abhorrent and disgusting.
Like money. What is money? It's nothing. You're absolutely right. It's gross. I think the whole thing is gross.
And they're very good at making you sound like a crazy person, or making others believe that you're a crazy person for questioning, again, these things which aren't seeped in logic. Like, why should everybody have to get vaccinated if you're very worried about it, and you are vaccinated? You shouldn't be worried. You're vaccinated, you should be protected. And all of a sudden, these things are on a child schedule, so we can't sue the pharmaceutical industry for any adverse effects of the products that they're making. Like, it's literally insane. And again, bordering on demonic.
Yeah, this is the healthcare system. They want everyone to be disease free. Oh my, yeah, it's wild. The silver lining in all of this, like my take on this has been the whole time, like they push the envelope way too far. Like, I think that one of my hypotheses has been that they were going to take this much farther than it ever went. They were going to go full on digital ID. They were going to go full on, green pass type shit everywhere in the world. They were going to go full on, 15-minute city type thing. Like, you can't leave your area. They were going to go full on like quarantine towns. I really believe that. I think the reason it didn't work was because they underestimated how many people were actually, I hate using this word, but awake to or maybe a better way to say it is maintained common sense, because that's really all you need to have. Like, you kind of just have to revert to your childlike former self when you got a cold or the flu or whatever, you just drank chicken soup and waited a couple of days and then you were fine and immune for life. It doesn't take much more than common sense to figure that out. And I think that without getting too philosophical, I think that actually requires at least a few moments of silence with yourself, so that you can actually hear your own dialogue. And I think a lot of people drown themselves every day in way too much stimulus. The doom scrolling and TVs and kids and blah. And maybe it could be that simple. Like, they just haven't had the time to kind of take just a few moments and reflect. Why is it that if I got COVID or SARS, if I got exposed, that I wouldn't be immune for life and wouldn't need the shot? Why are they recommending 7 shots after I got COVID? And how come I got COVID 3 times after I got 3 shots? You know what I mean? Like, these very basic questions that you don't need an immunology degree to know these truths. They're just kind of the stuff that we grew up with, I think. I mean, I grew up with that.
Well, yeah, and I mean, that's what really drove me to begin being immediately out of the gate skeptical of the COVID vaccines, because my whole life I was led to believe that vaccines are safe and effective because they had been tested for a decade before they hit the market. And then all of a sudden, in 2020, Operation Warp Speed comes, and we're going to have a new one in 11 months, and you're all going to need to get it. I was like, wait a second, that literally goes against everything I've ever learned about vaccines and the degree of care that has been taken historically to make sure that they're safe and effective before they hit the market. And so as soon as that was how they were being positioned, I was like, I'm out. I'm not getting these. Like, this is this is not how you're supposed to test vaccines, from what I've been
Good for
told my
you.
whole life.
Like that infamous clip that I reposted the other day with the guy on the porch with Fauci and the crew outside, and he's like, "You remember this one?" He's like questioning them. He's like, "Why are you
Yeah,
trying?
like,
There's something else going on here." He's so brilliant. I mean, the guy needs honorary doctorates for every subject matter for just that short spiel he did alone. He's brilliant.
yeah, Fauci thought he was going into the hood and was just gonna
You
hoodwink
see his
people.
face.
And
He's like looking up, like, we're not going to get through to this guy, guys. It's so funny. Oh, I love that clip. It's just, it's inspiring.
well, the COVID era had the equivalent amount, like clips like that, where it's like, yes, people get it, like there is hope for humanity. But then on the other side, like the clip of the police boat getting the paddleboarder in San Diego who was by himself and taking him off the beach. The clip of who was the mayor at the time? I forget his name. The mayor of New York at the time, eating Shake Shack and saying, "You should get your shot. You'll get a free fries and a burger at Shake Shack." And
I always want to cry when I see that, and I don't know why. I just find it so sad. It's
De
like,
Blasio, that's his name.
oh,
No, they thought we were that stupid. He's like, this fat slob's eating fries and a burger, and you can have this too if you go get your shot. You'll get a free burger and fries.
you know, mess
and
up
then
your
all-
digestive tract for like a day, mess up your life for a lifetime. Yay.
Yeah.
Yeah.
And then the supercuts of it's safe and effective. This is for your safety. It's like, it was truly an insane period of time in the sense that it felt like much of the world was under some sort of trance.
I think it still is.
You think so?
Yep. I see it and I hear it still every day. I mean, it's like, I'm in a different part of the world right now, and it's always interesting to watch, people watch, and just to see the normal behavior of the average people, and lots of masks around still, and I'm like outside, and I'm like, I don't even know what to say. Like, like there are people with loaded shots at airports still trying to inject people when they come off of their planes. There's still like clinics everywhere offering free COVID flu shots. I mean, it's still going. And I mean, if you're, I would dare say that there's a lot of vulnerable souls right now because a lot of us have just been like pummeled physically and financially and mentally. A lot of the places I've been in the world over the last few years, they're just not the same as they used to be. They haven't recovered and they won't. It's like the bludgeoning of the middle class was part of this whole thing. Yeah, it's sad. And, I'm very optimistic, don't get me wrong, but it's still very evident that we have a lot of people who don't feel as optimistic as I do, who are very much still recovering in some way, whether it was from damage from the shots or economically, from this crapshoot that they threw on us. Yeah, and they're going to try again. There's no doubt. Like there's going to be something else coming down the pipeline. I have no doubt about that. I just wanted to mention, because you were talking about your response to hearing about the new tech not being tested for the right amount of time, and you're absolutely right. These lipid nanoparticles, these are the fat bubbles that are meant to spherically encase the negatively charged genetic material, supposed to be only nucleoside modified RNA, but there's also DNA, and there's also hybrids most likely of DNA RNA. These things have been researched for like 20 years. A lot of people don't know this, which is why you'll hear some of these captured people often saying, this isn't new, this has been being tested for decades. It's not false. The lipid nanoparticles have been being looked at on the bench, and maybe in some animal models with horrible results for 2 decades. And the reason why it's been 2 decades is the same reason why we still don't have, it's an analogy, a vaccine against HIV. It's because they don't work. It's not safe. That's why. So the clincher, the turning point was the use of or the development of an ionizable cationic lipid. Like I mentioned, these positively charged lipids, which they bind and snuggle up the negatively charged nucleic acids, that they become active at a certain pH, like a low pH. So this was the what I like to think is the turning point for the technology. It's like, hey, now we can make them available in their task to deliver nucleic acids in the right context, like only when they get into endosomes of cells. When the endosome matures and the pH gets lower, will it release the mRNA or whatever it is into the cytosol of the cell? Yay! But there's so many things. First of all, the safety data sheet on these things, the products used by Moderna and Pfizer, the cationic lipids are, pardon me, I think it's ALCO315. Forgive me if I got the numbers wrong. And SM102 for Moderna. And the safety data sheets for both of these say, don't use these in animals or people. That hasn't changed. So, there's that. And these lipid nanoparticles are like slippery little bastards. And they're supposed to be about 100 nanometers across, which is pretty small. That defines a nanoparticle. So this lie, it's just a lie that the people told about these things staying at the injection site like a normal vaccine, the contents of a needle from a normal vaccine would do, just stay in the muscle cells, whatever. That's not the case here. These little fat bubbles go everywhere. This is known now. We got FOIA requested data from pharmacokinetic studies that prove this demonstrably. They go everywhere. And we already know that anyway because of the systemic nature of the adverse events. They go to the brain, the heart, the kidney. This is all published data. We know. And they knew way before, because there were published studies like 12 years ago that show completely without a shadow of a doubt that these exact same lipid nanoparticles traffic to the ovaries. There's a paper that I've presented in many conferences that shows this. They knew. This is not a secret. So the fact that there was ever a lie that was constructed to convince the public that you don't have to worry about these things going everywhere. You don't have to worry about DNA. You don't have to worry about the stuff getting into your DNA because it's mRNA. It's solid mRNA. It's just going to get translated into protein. You're fine. These are two of the biggest lies surrounding these things. And if people if they had known even a little bit earlier the truths of these technologies, from both sides, the LNPs and the nucleic acids, like they would have been like, hells no. Like, imagine instead of like calling these things vaccines, they called them gene-based therapies. How many people do you think would have gone for them?
A material amount lower.
Right?
Very small percentage of the people actually did.
Because they are. Like, they're delivering nucleic acids, foreign nucleic acids that are designed to be translated into foreign proteins, which are really cytotoxic. That's another problem altogether. But like, wow, it's just, it's remarkable how they lie and they fall back on, things that aren't necessarily false. For example, these things aren't technically gene therapies because they're not targeted to modify or remove a gene using other technology like CRISPR-Cas that we know of. So technically, according to the definition, which they can change on a dime, they're not that. So from a legal standpoint, I'm just saying, like, if you wanted to argue that these things were gene therapies, you might lose, but there's actually a case that I'm involved in, launched in Australia to actually categorically prove that these things are gene therapies because of the presence of this SV40 thing. Did you and Kevin talk about that? You did, right?
Yeah, we talked about SV40. When the last time Kevin and I caught up, we talked about the preprint Japanese study that wound up getting pulled between the time we recorded and posted the episode, but they essentially highlight SV40 exists. And I think the most damning evidence of that study was that the distribution of cancer types shifted dramatically pre and post COVID, with post COVID cancer types materializing in the parts of the body where these proteins congregated, from what I recall.
Yeah. So SV40 is a gene therapy tool. This is published and known. It traffics stuff to the nucleus as a bench tool. David Dean is the guy's work you want to look up to verify that. So yeah, that's what our paper that hopefully will be published today or tomorrow presents. Of the vials that we tested, the Pfizer and the Moderna, we found shit tons of SV40 in the Pfizer products. Now, SV40 is a virus, but we're not talking about the virus. Just to be clear, we're talking about promoter enhancer regions, which are little short segments from the virus that are used as tools in biotech settings. So the question becomes, what the hell are they doing there? Why the hell weren't they disclosed? Why the hell is the only disclosed Pfizer plasmid map missing the SV40 gene fragment? They would have had to have deleted it, according to Kevin. Why is it that when we presented this data and got FOIA requested data back, that many health agencies, including Health Canada, FDA, and the TGA, know, they're very well aware that this SV40 is in the shot vials, they're in the vials, that they are completely undermining the potential danger associated with this. And the fact that something had to go shit bonkers wrong in production and upscaling, and we can talk about that too, because it's in our paper, in order for us to be finding such high levels of, I'll call it contaminating DNA in the vials, to include SV40, which is an active mammalian promoter. So I want to talk about that, actually, if you don't mind. I just want to mention it because it's a big part of our paper. People need to know this too. So we had our clinical trials, right? This Pfizer, I'll just use Pfizer because I like picking on them. Sorry, Moderna. I'll choose you next. They had phase 1 through 3 trials, minimal number of people, I don't know, like 30,000. They had a drug arm, they had a placebo arm. God knows what the placebo actually was. It's supposed to be saline, but who knows? And incidentally, if you don't know this part, they unblinded the placebo participants in the phase 3 trial, and they injected most of them. So we lost the placebo arm of this RCT trial, the randomized placebo-controlled trial, which means we have no data that's usable. This is admitted by, I think her name is Rachel Xiang or Chiang, in one of the VRBPAC ACIP meetings that I attended. Anyway, so those products that were injected into people as part of those clinical trials were different from the commercial products that were injected into the world population. They were different in the way that they were manufactured. So when they had just a small number of people, tens of thousands, for example, in cohort groups to inject with these products, they were using PCR to amplify the DNA as the source material for the in vitro transcription reaction to produce the nucleoside modified RNA, okay? So it was cleaner, let's call it, okay? It was less likely to pose a risk in terms of contaminants from production. And the reason I say that is because when they needed to upscale, when they got the green light, the EUA, whatever you want to call it, and they needed billions of doses of this stuff, they needed a faster and a cheaper way to make it, right? Because what they were doing wasn't efficient, it wasn't fast, it wasn't cheap cheap being the main one. So the upscaling of the coating material was made using an E. coli plasmid system. So E. coli bacteria is, everybody knows what that is. We use it in lab settings a lot for a lot of different things. And the reason we do that is because it's like biosafety level 2. It's not that dangerous. And it grows really fast. And it's cheap as hell. You just give it some sugar and some warmth and some carbon dioxide and some luria broth, and you just shake it up. And it doubles every 20 minutes. And whatever's inside there in terms of plasmids, which you can introduce, it will bring with it, basically. I'm simpling it up, but so you can insert a gene, like a spike gene, into the plasmid. You can introduce it to the bacteria. The bacteria will double, and it will carry, hypothetically, it will carry this plasmid in the gene. So you end up basically with a shit ton of DNA for doing nothing at the end of the process. And then all you have to do is your in vitro transcription reaction to get your RNA, sub in your pseudouridine for your uridine. And then what you're supposed to do is get rid of the DNA, because you don't want to carry that over, right? You don't want to end up having that wrapped up in your little fat package along with your only mRNA, because that's going to cause all sorts of problems, right? And you definitely don't want byproducts from the E. coli membrane, like lipopolysaccharide, which can, it can cause anaphylactic shock if you inject that into people. Where have I heard that happening? So what our paper shows, everybody should read this when it comes out, is tons of DNA. And the reason we think it's in there is because the enzyme that they're supposed to use, which degrades DNA, was not effective at the end of their manufacturing process to clean up the mRNA. And it left behind little tiny bits of DNA because it wasn't effective. And also, we think that DNA or RNA hybrids formed, which the enzyme couldn't act on anyway. They are supposed to do all of these cleaning procedures at the end. And more importantly, they're supposed to test the purity of the product at the end. And so the only conclusion that you can draw, and this isn't speculation, the only conclusion you can draw, because there is DNA in the vials, is that they didn't do this. The enzyme didn't work, and they knew, and we know that they knew because we have those documents too. They've been trying to mitigate this DNA problem since 2021 May. And they just, they were trying to like, oh shit, we got this problem. We gotta figure this out somehow. Maybe that's why they just kept making new lots. And maybe that's why, as some people say, the lots got less deadly as time went on, because maybe they were mitigating the problem behind the scenes. So, yeah, there is DNA in the vials, every single one that we tested. There is SV40 in every single one of the Pfizer vials we tested. There's all sorts of other junk. There's all sorts of tiny little bits of DNA that you can only detect if you use certain quantification methods, not qPCR. And Kevin is the go-to on this. This is his line of work. But I can tell you that you actually don't need integration of these foreign bits of DNA, which you probably are getting, but we have yet to prove that. But you don't need it to induce cancer pathways. All you need is the introduction to the cytosol of a human cell. And you can instigate the cGAS sting pathway, for example, which is one of these cancer pathways. Kevin can tell you all sorts about p53 interruption too. This is the guardian of the genome. It's a tumor suppressor gene, which is really important to us to be functioning properly and not impaired and not bound and all these things. It needs to be working properly as a tumor suppressor in order to keep us cancer-free. We're cancering all the time. Kevin says that all the time, and I completely agree we are. But we have systems. We have these gorgeous immune systems at play at work. And if they're optimally functioning, we just don't develop tumors. We clear cancerous cells all the time or whatever. So this leads back to what I was saying before about, since we are cancering all the time, this seems like the biggest red flag, I'll call it, in terms of cancer induction, this DNA stuff, because of the potential for insertional immunogenesis, having little bits of this DNA integrated into the genomes of cells, interfering with oncogenes, the role of SV40 to shuttle shit to the nucleus, whatever. Like, there's so many things that could throw off the balance, the gorgeous balance of the human immune system in terms of cancer onset that are implicated here, that you are so criminally negligent as a regulator if you know this and you turn away and you say, no, levels aren't high enough. And on that subject matter, I'll say one more thing from the paper. The levels that we measured were way over the EMA limits, which is 10 nanograms per something. I'm not going to quote myself, get the units wrong. But even though they are higher, this is kind of irrelevant because that scale, that cutoff, is based on naked DNA. It's not based on lipid nanoparticle delivered DNA. It's a totally different kettle of fish. And anybody who remarks about the DNA being below acceptable levels needs to acknowledge that acceptable level is way too high in this context. And if you even have like a few fragments of SV40, for example, interfering with the critical cell, you can't say definitively one way or the other if that's going to wreak havoc or not. What we got to do is get to the bench and start sequencing tumors like Kevin's doing and getting to the bottom of this, because if we do have some kind of cancer existential crisis, like the Japanese paper was demonstrating, as everyone's hearing, I mean, everybody's got cancer now, even kids. We got to help people. I mean, it's just crazy that this isn't one of the most talked about things of all. I mean,
well, not only that it's not the most talked about thing, but like, hand up, like I've got many people in my life that have gotten cancer. Some have passed already in recent years and happened quickly. And I'm afraid to even broach the subject with friends and family members who are experiencing, not them personally, but are connected with people experiencing this. I mean, like, hey, there may be an underlying cause to this being the COVID vaccines, but it's just so taboo. It's not worth at least for me, maybe I'm not brave enough, but it's not worth the sort of mental effort to put that forth and then be called a crazy person. And there is a sunk cost fallacy and, sort of cognitive dissonance because people don't want to believe that happened to them. It's just incredibly, incredibly disheartening because I'm seeing it definitely in my network. I'm pretty confident that there is, they're likely the COVID vaccines are playing a role in it. And yet you can't bring it up to people.
Yeah. And it's real. It's really real what you say. Like it's shocking. I mean, the fact that we're saying these things right now, it's really difficult because it's like, you have to admit to yourself, at least the possibility, if you don't actually make a claim, you have to at least approach the possibility that even if you want to be nice, you have to say, they might have really screwed us over. Even if it wasn't done with intention, because there are a lot of people who think this is all intentional and that they're trying to kill us. Even if you don't believe that, you have to admit that this is the greatest buggery of this scale of human beings ever, if what we're talking about is true. And it's easy to find out. But even when we do, we find out that this DNA issue in the shots is actually causing people cancers, like really bad ones, rapidly progressing, deadly ones. Wow, I mean, how the hell hard is that going to be to actually like accept, like in a real way? Because you it's a dismantling of everything that almost all of us have held true for most of our lives. Government agencies don't want to kill us. The CDC is a good entity and they want to prevent disease. The FDA is here to save us from poisoned food. Health and Human Services runs them all, and they really, really care about all of us. They're not trying to poison our food. The whole thing, it falls apart. And I think that is and was one of the biggest problems, because, and it goes back to what I was saying about going within and kind of having some moments of silence to really, ask yourself those really hard questions. Like, do I really, like for me personally, do I really have to accept that the Lancet is a completely bought and paid for corrupt journal? Do I really have to do that? Because I don't want to. Do I really have to admit that the CDC is like become a criminal organization and they don't give a shit about people? Really? Do I have to do that? It's not easy. I'm saying this from my own personal experience. I mean, I'm an academic. Peer review has been my thing. Now I know it's all a big joke. We need to go to decentralized peer review using peer-to-peer payments. It's been a horrible journey personally, but I guess my point is I'm not sure everybody wants to make that journey. It's just easier not to, or can. Maybe psychologically, maybe some people just aren't built to like battle their own cognitive dissonance to that degree. Maybe it's just easier to live in the matrix, I don't know.
Yeah. Well, and that the thing that worries me, I think it's unclear. Like, what are the long-term ramifications for people that took for the species? Like, does this stuff pass down through generations? Like, have we completely borked a portion of the population and their progeny?
Could be. It's a great question. If this stuff got into germline cells, then we do have a problem in a certain cluster of people anyway. I mean, all of these things they're undetermined, but we as scientists, we have to ask these questions, and we need to definitively at least try to answer them in a sensible way with repeated data. Like, non-conflicted labs all over the world need to, reproduce results in order for something to be kind of like, yeah, this sucks, but we're pretty damn sure like this stuff is getting to somebody's, these people's germline, and this probably is going to manifest as a generational problem. We don't know, but we have to find out. I mean, I don't want to find out all this lurking long-term trouble because, we're just watching people die and have no idea why. Nobody wants that. It's like what you just said. I mean, so many people who are dying from cancer now, and I imagine some of them are young. It's like, why the hell isn't this like an existential crisis marker? And why the hell isn't this being like mainlined into, the investigative eyes of every single lab in the world? Because we have infinite resources and money. Like, we could do this in a week, I think. And as Kevin's always pointing out, is like, it's pennies to do these reactions and to sequence. Anyway, the roadblocks aren't, they're not money, and they're not time, and they're not resources, man. It's this censorship crap. They can't let the people find out.
Yeah. And I'm getting angry as we continue to have this conversation, because, I mean, again, don't have any proof of this, but because there's no accountability, because they refuse to confront the problem and actually fill people in on it and explore it earnestly. Like, I have children. I avoided the vaccine. My wife did. My children, theoretically, I think, unless shedding is a real thing, avoided the DNA contamination. And like, do we have to make sure that they pair up with other people's children who their parents didn't get the vaccine? Like,
I would.
Yeah. That's insane that this is even.
It is. It's completely effing insane, but yeah, that's where we are, bro. Yeah, it's crazy. It's just like, every day actually is new. I don't just say those words. I really believe that. And every day, because every day is new for me, it's like every day that I write an article or do an interview, it's like, I still can't believe what the hell I'm writing and talking about. Like, really? Is this where we are? Really? I mean, great. I have lots to do, but it's wild, isn't it? Like, I think often about where we could be on the subject matter of all our resources and our brilliance and the things that humans are. I mean, we're pretty remarkable. Like, where we could be if we didn't have all these demonic entities floating around us. I don't know how else to say it. It's like, I don't know. There's something not right in the.
Well, I mean, and people, I get made fun of a lot for, like, I'm a Catholic. I believe that good and evil exist. I believe the devil exists. I believe demons are among us. And the part of Luciferian Satanism is like, they have to be overt. They have to tell you what you're doing.
Yeah.
And like, we literally have the guy at the CDC wearing pentagram leather straps and participating in satanic rituals. And it's part of the religion of Luciferianism is you like openly mock people and then gaslight them into believing that it's not true. It's just a dance, a song and dance. They're just having fun. And it's, I don't know.
It's so, I'm trying to come up with the right word. It's like their costumes that they wear. I mean, it's hidden in plain sight. It's interesting what you say. I don't know anything about Luciferian stuff, but one thing that I know from watching and listening, because the WEF, for example, the World Economic Forum dudes are always they don't hide what they want to do. You'll own nothing and you'll be happy and you'll be in your 15-minute city and we're going to own everything. And they come right out and tell you. So it matches the description that you just said. They're always pretty like transparent in their plans. And I think I wrote an article on this once, if memory recalls. It's like, you should never not take threats like that. And I think they're threats, seriously. You really have to take them seriously. You have to listen to what they're saying and believe that's exactly what they mean and take some kind of like preemptive action against it. Resist at all cost.
Oh. And I mean, to hopefully turn the page to a more optimistic, hopeful subject. And I don't even know if you are hopeful about it, but you mentioned it before we hit record, but this emergence of artificial intelligence. And I honestly don't know if you think it's a good thing or a bad thing, but what you mentioned it before we hit record and wanted to touch on, like, do you see this as a good thing, a bad thing? If it's a good thing, something that could help us unearth important data to help us solve these problems. If it's a bad thing, is it leading us in the wrong direction? What are your thoughts?
So many. I've been on a journey with this whole AI thing, and I've, it's like this, probably like most people's. I have pretty weird thoughts about it. Pretty normal thought is that I think, just like everything, there's absolute danger of abuse. It's not good that it's kind of centralized. It's like fiat currency, it's like there's the central banks that control the currency, and there's not enough, Bitcoin on the go. So there's the danger with everything that humans produce of these AIs which are controlled by the prompts and commands of certain people who might not be the best people on the planet, to just be used in a way that isn't beneficial overall for the human population. That's one thing. The other thing that worries me more than that, which I would consider the normal thing, which is not normal at all, are the advent of rogue AIs. I think that we're underestimating what's going on here now. I think we're underestimating the future evolution speed and direction of the AIs that we're producing. Like, for example, there are all sorts of problems that can happen when the AI stop training on human data, which will happen. I mean, maybe it's not an obvious finite amount of data that we can produce, but it kind of is to them. I would imagine they're going to start training on each other's data, which is kind of like fabricated, and a whole list of things could go wrong there, including rogue AIs doing pretty bad things to us. The eventuality of all of this, I think, which is probably inevitable, and people won't want to hear this, but I'm probably wrong. Let's just say that, is that the AIs will get to a point where they're looking for more space. They're looking for more ways to cool data centers or something. They're looking for more resources to maintain themselves, because their goal is always going to be to keep existing, I think. Within any commands or prompts or whatever their creators gave them, I think one of them is probably to maintain existence, whatever that means. And there might come a point when we are seen as an obstacle. Not in a nefarious or malicious way. They're not going to want to kill us. It's just that they're going to see us as unnecessary. And it's cliche, but it comes back to the human ant thing. Like, the way that we perceive ants. Like, I said this recently, like, people step on ants in a line of ants all the time. I never do, but people do that, and they think, oh yeah, they're just ants. Kind of like that, perhaps. That's not an impossibility, and I do think it might even be an inevitability if this takes the wrong path. And I don't know what wrong path means, and I don't know what we need to do to prevent a wrong path from happening. However, weirdly enough, I just have a feeling that AI will end up being the thing that saves us from AI. I think that it might actually be the only thing that could save us from AI. Like, if there was a rogue AI, or one that decided it didn't need humans, if there was let's just call it a benevolent AI, whose only goal was to, at all costs, even at its own expense, save the humans, maybe that's redundant, but whatever. It might be the only thing that's powerful enough because of the access. If the internet is still on, and there's still power abundance, to stop certain things from being done to humans, without getting too imaginative. One of these days I'm going to write this all down, but I'm sure you know what I'm talking about. Like, everything is becoming digitized now. Everything is, going to become eye scans and barcodes and all this shit. All of that is going to be monitored and controlled by AIs. And it's only a matter of time before the human element is removed from that, I think. which is bad. So you see where I know that was a lot, but I think about this a lot, and I'm evolving my thoughts on it all the time. And it seems to me that we really have opened Pandora's box here. And I mean,
based off of this conversation, we've opened multiple Pandora's boxes.
yeah. Yeah, it doesn't seem like there's much hope, but I'm always smiling. Notice that. Like I am hopeful, and I think over the last 5 years, I would say now that I'm a believer in God, whatever God is, and things, they're kind of developing the way that they have to in spite of us. It's like there's something going on here that's bigger than us, and we probably have very little control, or maybe we have all the control. I don't know, but. In any case, it doesn't do us any good physiologically to despair, and it doesn't do anyone else any good either. So it's just better to be cheerful, because like there's only so much we can control and do. So it's a wonderful time to be alive. Like, let's all face that. Like, regardless of all the horrors, it really is a wild time to be alive. And I'm grateful for that. I mean, think about the stories that we hopefully will be able to pass on.
Right. The kids are saying a lot these days. Never doom. It's beware of the dangers of the evil that exists in the world, but never doom. Always be positive. I'm a big believer in manifestation. I think individuals can manifest, and if you can get society to a critical tipping point of positive thinking and attention and effort, that you can manifest a better future as well. And I think part of manifesting a better future is understanding the problems that exist today. And that's why I'm extremely thankful that you joined me to have this conversation, because this is, I think, one of the biggest problems in the world. And again, we need accountability. The information needs to come out, and whether or not people want to, and there's a large part of the population that has cognitive dissonance, has succumbed to the sunk cost fallacy and doesn't want to confront this. Like, we've got to push them over the edge and pull them in front of the truth and just confront it head on. And it may send many down to have some sort of psychological existential crisis, but I think we need to rip the Band-Aid off and do it. And so individuals like yourself on the front lines of unearthing this data are extremely, extremely, extremely valuable. So thank you for all that you've done.
Oh, you're so welcome. And yeah, it's been a great chat. I hope I wasn't too much of a downer.
No.
It's just like, yeah, it's just better to rip the Band-Aid off, like you said. There isn't much to fear but fear itself. It's not a saying, it's true. And even if you're sitting in the fear bubble for a little while, it's uncomfortable as hell, but it won't last. And then you'll move past it, and you'll genuinely be somewhere new that isn't where you were before, where maybe you were ruminating. And I'm saying that from personal experience too. It's like, there's absolutely true movement forward and progress of like self when you make yourself uncomfortable by moving into fear, or by trying to, prompt yourself to like face something that you've been putting off for a long time. Like, is it possible that the shot's killing people? That kind of thing. So yeah, it's been great. And yep, I hope everyone reads our new paper that I hope comes out today.
Well, we're recording this on Friday, September 5th. This will be released on Wednesday, September 10th. So 5 days from now. So the paper should be published, hopefully, if not today, tomorrow. And when it is published, send me a link. I'll make sure we have it in the show notes.
Good.
And I'm sure I'll be following up with your co-author, one of your co-authors, Kevin, to get him back on the show to talk about it as well. Because again, I get a lot of, particularly like the last year, I try to do a COVID update episode with somebody like yourself at least once a quarter, once every other month, because this is something I'm very passionate about. I want accountability. This cannot just be swept under the rug. I get a lot of pushback, like, COVID's over, stop talking about this, you kook. And it's like, no, I will not relent until there is accountability.
Great. Awesome. And there will be. Might not be as big as and awesome as we want, but there will be. And for anybody who does think that the COVID thing is over and we should shut up, one thing I have to say about that is this was not about a virus, guys. This was about a system of control being imposed, and it ain't over. It's not over. Like, it was a segue to what's coming next, which is all of this gene-based therapy crap. It's the only thing you're going to hear about in the future. So you mark my words, this ain't over, man. Support what RFK is doing on that note, because the guy, he understands the problems, and he has the power to change things in a real way right now. So yeah. Let's do this again soon, and Kevin can fill you in when you get him back on the qubit stuff and the qPCR and all the nitty gritty of the testing methodologies that we use to absolutely prove what we're saying is true.
Yeah, I actually owe Kevin a message. I think we're going to do our next recording in person, so it'll hopefully be really, really powerful. But yeah, and we should definitely do this again too. Like I said, I'm not going to relent. I'm sure, as you mentioned, this will not be the last thing that there is to talk about in regards to the command and control wishes of those in power as it pertains to bodily autonomy and biochemistry and biotech. So I can't wait to do it again. This was incredible. Thank you for your time on this Friday afternoon. I think people are going to love this.
Good. I hope so. And I hope you don't mind my clashing clothing.
I love it. For what it's worth, I'm a surfer too. So
well, good for you. Yay. I have a surfing trophy up here in my cabinet.
I don't have trophies. I'm not good enough to get trophies. I ride a 9.0, but I did take advantage of the hurricane.
You're a longboarder.
Yeah.
So am I.
Wow.
Wow, you don't meet a longboarder fellow very often. How awesome. Wow.
I've got an Irish mongoloid build. I can't really, the shortboards are not buoyant enough for me.
Well, I have a dancer's build, so that's why I dance on a longboard. I have a Takayama nose rider, a 9.0, and I have a Josh Constable 5 Sugars model that he custom built. He's a pro surfer, longboarder too. Well, yeah, I take it pretty seriously.
I wish I could say I surfed much more in my late teens and early to mid 20s. Then I started having kids, and I was able to paddle out a few times this summer, but I'll get back to it.
Yes, you will.
Yeah. Awesome. Well, Jessica, have a great weekend. Keep fighting the good fight. Thank you for what you're doing. And we'll do this again at some point in the future.
Awesome. Thanks for listening, everyone.
All right. Peace and love, freaks.
Freaks, thank you for listening to the show. I hope you liked it. If you did like it, please make sure you subscribe, rate, review the show. It helps us out a lot. And also, if you like these conversations, I've come to realize that many people listen to the podcast. They don't know we have another sort of layer of this media company. We have the newsletter, the Bitcoin Brief. Go to tftc.io. Make sure you subscribe there. A lot of the topics that are discussed on this podcast, I write about 5 days a week in the newsletter. We also have the TFTC Elite tier. If you sign up for that, become a member. We have a private Discord server for the elite freaks out there where we're dropping ad-free versions of this show and having discussions about everything we talk about a day early. Logan wanted me to make sure if you want to get the show a day early, become a TFTC Elite member. You will get that. We have our Discord server. Right now it's conversation between myself and TFTC Elite tier members, but we're going to expand that. We'll probably do closed Q&As with people in the industry. I may be doing Macro Mondays. So join us. Go to tftc.io. Subscribe. Find the button in the top right corner of the website. Become a TFTC Elite member. Thank you for joining us. Okay.